to the Africa. Welcome to the Africa Cancer Research and Control ECHO Program 2021-2022. We're delighted to have you all with us, all of you, and we're expecting more folks to be joining in as we go along. My name is Benda Kithaka. I'm from Kenya with Kilele Health Association, and I'm going to be your moderator for the day. The ECHO program today is going to be our first session for the 2021-2022 programming. And we're looking at strengthening cancer control health promotion efforts through a focus on tobacco control. As we do so, we are hoping that this session will provide us with an opportunity to discuss challenges and opportunities to integrate tobacco control and cancer control efforts in Africa, as well as in our practice, day-to-day practice. But we're also going to be looking at the role of civil society organizations in advancing and sustaining policy advocacy in health promotion activities. I know it's quite a bit of a mouthful, but we do have two presenters who are going to be awesome at giving us what it is, breaking it down for us in terms of challenges, opportunities, as well as the role of civil society organizations in ensuring that we can keep up our advocacy for health promotion in Africa. Just a quick reminder that if you're not speaking, kindly mute your microphone so that then we have one meeting. If your bandwidth does permit, kindly put your video on. It'll help make our session more interactive and we get to see your faces as well. And you can use the chat to introduce yourself. You can also use it to ask questions, to make any comments, to also reinforce some of the messaging that we're going to be receiving today. And we will be checking the chat often so that if we have any questions, we can be able to address them as we go along. The sessions are recorded, and this is usually sent after every session to the larger ECHO community, the larger Africa Cancer Research Control ECHO community. And as I mentioned today, we do have two amazing presenters. But quickly, I will introduce why it is important that we're discussing tobacco control today. Did you know that tobacco kills about 8 million people worldwide every single year? And 80% of these deaths occur in low and middle income countries, regrettably, where a majority of the world's smokers live. Did you also know that tobacco does cause secondhand smoking causes 1.2 million deaths per year? These are gross and really troubling statistics when we think about the people behind the 1.2 million faces, or if we think about the 8 million people who are dying of a preventable cause of death. And if you also think about the number of cancers that tobacco does cause, and it is shown to cause oral cancers, lung cancer, liver, stomach, bowel, ovarian cancers, as well as some types of leukemia. It means that it really needs to be one of the areas of focus that we should be concentrating on as Africa Cancer Research ECHO. And it has been proven that quitting at any age can make immense differences to the user in increasing their life expectancy, improving the quality of life, and I bet it also does improve the quality of life of the people they live with, therefore eliminating the secondary smoke exposure. Because of that, I'm delighted today that we have two amazing speakers who are going to be taking us through what they have been working on and what is available that we can utilize as resources for us to be able to do better tobacco control in our region. To start us off, we have our case presenter, Achieng Otieno. He's from Kenya. He works with the Kenya Tobacco Control Alliance, KETCA. Achieng is a communication and digital advocacy officer at KETCA, and Achieng has worked in this field for over 7 years. He holds a BSc in computer science and a higher diploma in marketing and business communications. That explains the communication and digital advocacy role that he plays at KETCA. Achieng is going to be taking us through the opportunities and the challenges that exist to integrate tobacco control and cancer control efforts. Achieng, take it away. Thank you.
Oh, thank you, Benda, and thank you for that introduction. Yes, my name is Achieng Otieno. I work with the Kenya Tobacco Control Alliance, as Benda has rightly said. Indeed, for me, it's an honor to be part of today's discussion and also just to share my presentation with the team around today. Largely because of what Benda has mentioned, the important and the critical pillar that tobacco control holds in cancer control. We all know that tobacco epidemic is one of the biggest public health crises that we are facing in our time today. It is responsible for 8 million deaths, as Benda has mentioned. And when you look at it, you come to realize that as a matter of concern, tobacco is linked to up to 16 cancers. And one in every 5 cancer deaths is linked to tobacco use. Tobacco use is the single most preventable risk factor for non-communicable diseases, which includes cancer and diabetes plus the rest. So that's why our main focus is on tobacco control. And I'm delighted today, again, I'm humbled and privileged again to share our experiences in tobacco control, in support of cancer control, and largely in support of public health. And I believe that today's session will be able to learn and share experiences on what we've gone through, the things that we've been able to accomplish, and how we can intermarry the two. So thank you. Maybe allow me at this point just to share my screen as I start my presentation. Okay. I hope you can all see my screen.
Yes, we can. Kindly put it in presentation mode. Thank you.
Okay, just a minute. Sorry. You can now see it properly. Okay. Benda, kindly confirm for me whether you can see it properly?
Yes, we can see your slides very well. Thank you.
Oh, beautiful, beautiful. So as I mentioned, my name is Achieng Otieno. I work with the Kenya Tobacco Control Alliance, and I've been with the organization for over 7 years. And in tobacco control, we've been doing quite a number of things. First of all, we probably maybe for those who are new to tobacco control and maybe the Kenya's participation in tobacco control, this slide here will just give us a brief intro on why we are here. Tobacco control in Kenya, the clamor for tobacco control began in early 90s, and it was mostly being pushed by medics. And come to 2004, Kenya made a very bold move and a very historic move by signing and ratifying the WHO FCTC. In fact, Kenya became the first country in Africa to sign and ratify the convention, and it became the second country to ratify it globally, which shows how much Kenya actually looked at tobacco as an issue and decided to take a bold move. In 2005, there was a clamor for domesticating the convention, because part of, after signing the convention, it is a requirement that the countries need to put in measures, in-country measures to control tobacco. So in 2005, there was a push to domesticate the convention. And there was also a push for civil society, or rather a stronger voice, so that the push for tobacco control measures and even localizing the convention became more of a force to reckon with. And that pushed us to why KETCA was formed. Actually, KETCA was formed by government people with civil society coming together, showing the need of having a voice that represents tobacco control and a voice that would actually push for the domestication of the convention, and also coming up with a tobacco control law or other measures that would actually help the country in fighting the tobacco epidemic. So what is KETCA? KETCA is we are an umbrella organization for civil society who support tobacco control in Kenya, and it was established in 2006. The Alliance has a membership of about 20 organizations across the country. It's a national alliance. The Alliance tries to coordinate tobacco control activity towards a tobacco-free Kenya. The Alliance works to strengthen collaboration between civil society and government, because you realize initially there was a lot of strife between civil society and government. So the Alliance came in to build a bridge between the civil society and the government. Part of the Alliance's mandate was to build strong partnership within local, regional, and at global levels. The Alliance also endeavors to build a stronger tobacco control voice by building the capacity of members and different stakeholders. The Alliance is built on four pillars, rather. That is policy legislation, research, public education, and alternative livelihood. Maybe as we proceed on, maybe we might see the need of all this. So this is how we approach tobacco control. Most of our tobacco control effort is informed by research, because we realize that advocacy in itself, without any facts, without any data that can be relied on, it's just making noise. But when we have data that backs our advocacy, it's very easy for us to advocate for policy, and even for the public to respond to the messages, and even to the tobacco control call within our jurisdiction. So this is basically our approach. We carry out research for our public education and for our policy advocacy. So as I've mentioned, tobacco control in Kenya began in early 90s. But in latter years, 2004 to be specific, and 2007 became very historic in our country, because that is when the country signed and ratified the convention. And in 2007, the country enacted the tobacco control law, which meant that the country has officially domesticated the WHO FCTC Framework Convention on Tobacco Control, which largely looks at two key things: that the demand of tobacco control and the supply. We are trying to address both aspects in different ways. So the law comprehensively came to address those two key pillars of the convention. Apart from the law, there has been a lot of advocacy around the implementation of the law, which between 2007 and 2010, there was a lot of improvement in terms of reduction of people using tobacco. In 2014. The country also developed tobacco control regulations, which were meant to strengthen certain provisions of the tobacco control law. And these provisions like specifying the public spaces, because the law came to ban public smoking in public places, rather creating safe environments and clean environments. So the tobacco control regulation came to strengthen some of these provisions. So when you look at the tobacco control regulations, there are provisions highlighting the importance of having graphic health warnings on the tobacco packs. The public places were clearly defined, and one of the most important things that the tobacco control regulations also brought into force was what we are calling the Solatium Fund, because the Tobacco Control Act had created a provision for tobacco control fund. So under the tobacco control regulation, there was specifically how the Tobacco Control Act, or rather Tobacco Control Fund, will be resourced. And there is a very strong provision on what we are calling the Solatium Fund, which is meant, it's more like a levy that the tobacco industry has to pay into to deal with the effects that the tobacco use causes in the country. Unfortunately, in 2015, we faced a challenge, which I've highlighted there, the tobacco industry. British American Tobacco is the largest shareholder within the Kenyan jurisdiction. They decided to take the government to court, challenging the tobacco control regulation, saying that they are not constitutional and it will infringe on their business. So we went, Ketka was part of the team that was enjoined in the case to represent the public views. So at the High Court, the case was ruled in favor of the regulation, so in favor of government. Then it did not end there. The tobacco industry decided to go to the Court of Appeal. They appealed the judgment. And at the Court of Appeal, after a long push and pull, it also ruled in favor of the regulations, which means that they were now enforceable and the government needed to take steps in enforcing the tobacco control regulations. But it did not end there. The tobacco industry now decided to pull in the British American Tobacco, decided to bring in other tobacco industry players, the Mastermind and Philip Morris, into the case. So they decided to go to the Supreme Court to delay the process of implementation. But in November of 2019, the Supreme Court ruled in favor of the tobacco control regulation, which was something that was celebrated globally because of the importance of having these regulations in place. And also it was a big win for the global public health movement. There has been a lot of tussles because currently the government is working on the second round of graphic health warnings and all that. But as tobacco control advocates, we are up to task. It is something that we've always battled over the years. So in 2015, Kenya adopted a very progressive tobacco tax measures. You know, tobacco tax and pricing policy, rather measures or strategies, are the most proven strategies to deal with tobacco consumption. So in 2015, Kenya adopted very progressive measures that brought in what we are calling a unified tax strategy, meaning that all tobacco products are taxed equally, and which was a loophole that was being used by the tobacco industry to sort of evade taxes with coming with different product differentiation, as we are talking about. But in 2017, we suffered another setback when the Treasury decided to regress on those measures and decided to go to the differentiated sort of tax measures. All this will be, I'm sure our other presenter will also be touching on this, so it will be very clear. I'm just taking us through the successes that we've had. In 2017, Kenya launched the guideline to support cessation, because, you know, as Benda talked about the importance of quitting. The government also made a bold move to come up with the cessation guidelines, just to support those people who would like to quit. And in the same year, the government also banned what we are calling water pipe, largely known as shisha and hookah. And in 2020, Kenya became the 59th party of the protocol to eliminate illicit trade on tobacco products, which is it's a great move, and also a step towards having a tobacco-free Kenya. Largely, for all the things that I've mentioned behind them, we attribute that to dealing with the policy actors. because policy actors, the policy makers and the policy implementers play a very key role when it comes to policy formulation and also policy implementation. So we worked very closely with the different policy actors within our parliament, within government ministries, and also other government departments that really supported this move, and we owe the success to this collaboration between government and civil society. Then we also had the civil society actors who are playing a key role in terms of providing data, in terms of providing facts on the issues at hand, and also for the advocacy, and also playing an active watchdog role just to ensure that the tobacco control policies that the government comes with are properly implemented, and also carrying out monitoring activities just to ensure that there is compliance with the laws that are there. The media played a very critical role when it came to dissemination of information, and also public education, and also exposure to different violations. When there are violations by either public officers, or maybe even the tobacco industry itself, the media played a critical role in highlighting this. Because I remember when we were in the process of coming up with the law, the tobacco industry decided to take some parliamentarians to Mombasa. Mombasa is one of our tourist area with a lot of beaches and all that. So the industry decided to take them there. But through the media, we were able to highlight all this. And when they came back, they were very shameful, and they could not tinker with the law, as it were. And by that, it passed. Then the public is a very key component, played a very key component in advocacy, and still does, because we work at the community level, going all the way to different aspects of the public. And at this point, the public really supported us in pushing for policy change. When it came to the law, the public really, there was an outcry, the public outcry. We need a law that will protect us from exposure to secondhand smoke. And at this point, the public really played a very critical role in supporting the move, and also in monitoring and whistleblowing. Whenever there are violations at the grassroots level, the public were at the forefront in sharing this information with us, and we were able to raise it with the relevant authorities. So some of the strategies that we were able to apply even in our advocacy. One, we were able to build champions even within the policy makers in parliament and in other government departments. We were able to build champions, people who could actually speak on our behalf in parliament, people who could actually push for the tobacco control agenda. Secondly, we also build strong networks and alliances of supporters, people who support tobacco control, not necessarily tobacco control actors alone, but there are people who are outside the tobacco control fight, but they're within the public health, or maybe in different other departments, and they were able also to join force with us and to push for some of these policies. Like, for instance, at this point, Ketka is a member of KENCO, which is very strategic for us, because we are looking at the close link between tobacco control and cancer control. If tobacco control is effectively addressed, we will be in a position to address the 16 cancers that are directly linked to tobacco use. Secondly, there is the NCD Alliance, which is the umbrella body for organizations that are in support of non-communicable diseases, or who are advocating against non-communicable diseases and the like. That is at the local level. Our networks span to the regional and even to the global level. At the regional level, we have the African Tobacco Control Alliance, ATCA. At the global level, we have the Framework Convention Alliance, the Union, and the NCD Alliance Global that we are all familiar with. Thirdly, we were able to build a very reliable network with the media and also champions within the media. Like I mentioned, the media played a critical role. And you know, the media, dealing with the media is usually a bit dicey. But now when the issue is when they own the issue, it becomes easier even to push the tobacco control agenda within the media circles. So we have a very strong media network that willingly they would actually raise issues relating to tobacco control. Collaboration with government ministries and departments. This played a very critical role and still does. The Ministry of Health, tobacco control is actually housed at the Ministry of Health. So our collaboration with the Ministry of Health, the Tobacco Control Board, the Kenya Revenue Authorities makes it easier for us even to push the tobacco control agenda, and makes the work some of the things that we're advocating for achievable. But all these within all these successes and all these strategies, there are still challenges. Some of the challenges that we've faced and we continue facing is the tobacco industry. Tobacco control really touches the heart of the industry. So tobacco industry is a major player when it comes to interfering with policy formulation and policy implementation. So that is one of the biggest challenges that we constantly face, because they keep interfering from the policy development level to the policy implementation and enforcement level. Then there is government bureaucracies. These tend to slow down some of the things that we intend to achieve, especially when there are things that you need quick responses. The government tend to slow this down because of the bureaucracies. Then there is the government departments and the ministry that are sympathizers or that are sympathetic to the industry. Like you have the ministries of trade and industry, you have the Kenya bureaus of standards. These are government ministries and departments that we've come to realize over the years that tend to sympathize or tend to lean towards the industry. Then there is the pro-tobacco industry policymakers within Parliament. This is one of the biggest challenges that we faced during the enactment of the Tobacco Control Act, that we continue facing up to today, because we even have members of Parliament who are pushing for the review or the change of the law, just simply because they want to introduce certain things that will be pro-tobacco industry. Then we also tobacco control work and cancer control and just public health in general requires a lot of resources. But as we all know, there is always insufficiency of resources to address the issues at hand. But that notwithstanding, we keep on fighting together. Then there are political uncertainties. Tobacco control and even the Public Health and Cancer Control Actors who are here can attest that the political uncertainty in the country really affects some of the progresses that we're making in advocating for public health policies or implementation of certain public health laws. Currently, Kenya is going through, we will be having elections. And during this election period, we've also realized that is when the tobacco industry becomes very active. One, they sponsor parliamentarians, people who go to parliament, who will be pushing for their agenda. Secondly, this is when some of the laws that have been put in place get a lot of interferences. That this is when we get a lot of violations, and the people within this meeting can also attest that from January this year, there have been a lot of violation. The tobacco industry has been caught sponsoring different events, and the law violates tobacco advertising, promotion, and sponsorship. So they tend to blatantly violate the law. What opportunities are we seeing here? Sorry, Brenda?
Yeah, I would ask that also, as you discuss the opportunities, we can wrap it up because the time is really not in our time.
All right, thank you so much. I'm actually, this is probably my last slide.
Thank you.
So what opportunities are we seeing? We are seeing, like I mentioned, the importance of having strong networks. We are seeing opportunities for building strong partnerships. We are seeing opportunities for building alliances for common good in support of tobacco control and also in support of cancer control. We are seeing opportunities for collaborations in addressing issues jointly, especially those cross-cutting issues, like tobacco being a serious factor for cancer and other NCDs. We are like tobacco, raising tobacco taxes to support cancer treatment, among other things. And by and large, we feel that if these things are addressed and tobacco control is prioritized in all our advocacy effort, we will be able to support cancer control, and we will also be able to support public health by and large. So thank you so much for that, and maybe I'll be open for questions maybe thereafter. Thank you so much, Benda and Mishka.
Thank you so much, Ochieng. And so we will take questions at the end of the session because the time has really flown on us. I will now introduce our didactic presenter. And this is none other than Yannick Romero. He is the Knowledge and Advocacy Manager within the Knowledge, Advocacy and Policy team at UICC. Yannick's work focuses on tobacco control globally, developing and gathering evidence-based information. And in addition, he dedicates his time to national cancer control planning, which consists of analyzing and evaluating country cancer control plans in the frame of international cancer control partnerships. In the past decade, he has worked in the area of cancer, communicable diseases, and genetics with multiple stakeholders, including private companies, hospitals, research institutes, as well as civil society organizations. Yannick is also a holder of a PhD in biology from the University of Geneva Medical School. Yannick, please take it away. Thank you.
Thank you, Benda. Do you see my screen as a slideshow?
Yes,
Perfect.
we do.
Good. Well, thanks a lot for the invitation today. And I will be quick about the numbers. We heard about the numbers about tobacco control, the burden of tobacco consumption, and so on. But today I wanted to really show you how an organization such as UICC is working on cancer control can align its efforts with tobacco control folks to have an impact on that and maximizing this impact on the cancer control and tobacco control policies globally, but also nationally in countries. So, you know, all UICC, I will be brief in that introduction. Actually, we can skip to this slide, where the importance of this slide actually is networks, is different stakeholders and partners. In a nutshell, we are part of the, we are NGO observer of the FCTC COP. We have more than 50 partners in cancer organization, but also we are founding member of NCD Alliance City Cancer Challenge Foundation, the McCabe Center of Law and Cancer, and the ICCP. And that slide has an importance. It will have an importance at the end of my talk. We have 3 areas of focus actually, and different activities. We convene the cancer control community, the NCDA community, to different platforms, I would say, the World Cancer Day, as you know, the World Cancer Congress, or the World Cancer Leader Summit. We have also capacity building platforms. We grant fellowship, we have leadership development, and also the team where I'm working, the knowledge and advocacy and policy team, where we want to put cancer control in the global health agenda, actually. And that also has an importance for tobacco control. So we want to work actually together for international tobacco control and involve all the stakeholders. Why? You've heard the numbers about the death due to direct consumption, the second-hand smoke. The number of smokers worldwide is 1.3 billion, and that number is stable. And even if the smoking prevalence is decreasing, we have still more than 1 billion smokers in the world, and 80% of those tobacco users, not only smoking cigarettes, but also chewing tobacco, also using smokeless tobaccos, smoking shisha, and so are located in low and middle income countries. And there is a social cost, which is really high for tobacco consumption, which increases the poverty and discrepancies between and within the countries. So we thought that tobacco control is really integrated in cancer control, actually. And we need to synergize our efforts to really tackle that issue. So how it's really to identify and engage the different stakeholders, not only the cancer community, not only the tobacco control community, but the health communities, the governments, the public, actually, and other organizations beyond health, sharing knowledge and raising awareness and building communities and expertise in countries. And what we do actually is really to relay that information during the conference of the parties of the FCTC, but also engaging the public and policymakers, countering, and we've heard that from Acheng, actually, the lobby from the tobacco industry. And also, when you advocate with governments, it's really showing the benefits of tobacco control investment in country, as we do for cancer control, is that when you invest in tobacco control, when you invest in cancer control, then you have benefits from that at the health system level. So integrating tobacco control plans in broader NCCP and health strategy is key for us at UIC and ISUC, and this is one of my role actually. So the three different key approaches for our tobacco control work is really to connect and engage the different stakeholders, to raise awareness, and that is based on evidence actually. And this is what you were saying actually, Acheng, about your advocacy work that has to be based on data. Today, I just want to show you three different areas of focus that we have at UICC. It's tobacco taxation, tobacco advertising, promotion and sponsorship, called TAPS, and smoke-free environment. We are not forgetting all the different measures about tobacco cessation and other empower measures, but we thought that those ones can be addressed in many different settings. So why tobacco taxation? Because it's the most cost-effective measure to reduce smoking, actually. When you increase 10% of the taxes, the excise taxes, it leads to a 4 to 5% decrease in cigarette demand. So because they are made less affordable and specifically in low-income settings. And tax incomes can serve to invest in health systems and prevention programs. So it's a win-win situation for health and the economy, actually. But there are challenges, is that only 40 countries in the world apply the 75% excise tax that is recommended by the WHO. And also the challenge is the tobacco industry, as we mentioned, is that their lobby suggests that when you increase the tax in your country, they said to the Ministry of Finance or Economy or the government, it will cause declines in revenues actually and increase the illicit trade, which is completely a fallacy and false. So this is why we want to work on tobacco taxation, because it can bring more income to building back actually health system, and especially after the COVID pandemic. Then why tobacco advertising, promotion and sponsorship? We focus on that because we want to counter the misinformation to the public. Here is a slide where you could see the marketing of the tobacco industry. In the 50s, they were showing celebrities, and now they are using the same with e-cigarettes, for instance, that are owned by tobacco industry. They use different tactics, and there are a lot of studies on how they work, making the parallel with, for instance, the well-known packs of Marlboro here with Juul, which is an e-cigarette, making a glamorous image of smoking, also sponsorship of sports, sponsorship of music festival. There is also all this image beyond that. They also corporate social responsibility. Here there's an example of Philip Morris International receiving a prize for climate change or something like that. They also use the language of the tobacco control people, such as the Unsmoke campaign, saying that they want to make the world smoke-free. And also on the bottom, this image with teenager, I think it was in Slovenia, British American Tobacco was sponsoring a smoking prevention program. And that's, I think it's the cherry of the cake, which is completely hypocrisy, 100% hypocrisy from the tobacco industry, just to show you why we want to tackle tobacco advertising. And yeah, numbers, tobacco industry spends $23 million US per day in marketing, per day. So, which is really huge. And this is their power. And they use classical marketing in retail shops. There is a picture there, I think it was taken in South Africa, where you have students just standing in front of a retail shop with a lot of different advertising of cigarettes. The next area that we want to focus is really a smoke-free environment. And because of the number of deaths due to smoke, to the secondhand smoke, we want to protect employees in restaurants and offices, public spaces, and so on. And just to tell you, and I will be quick, Benda, I see that you unmuted, so my time is done. If you go on uicc.org, we have a lot of different resources for World No Tobacco Day, virtual dialogues. There's a virtual dialogue that we started about how to make partnerships and align the efforts between cancer control and tobacco control. And finally, curbing tobacco consumption is we have a multi-sectoral approach. We need the collaboration of different aspects, sectors such as the finance to divest and taxation, health is to train and educate the workforce, policy is to develop evidence-based and independent studies, report marketing tactics from communication, apply anti-tobacco laws. And this is what we have from Acheng. It's a whole journey actually to fight the tobacco industry. It took 6 years, I saw that from Acheng presentation, the ruling of BAT versus the governments, and raise awareness on detrimental impacts on the environment and workers' condition in the tobacco field. So briefly, very briefly, what we think is that to prevent tobacco and to have really a matching between cancer control and tobacco prevention is to understand the determinants of tobacco consumption, so we can engage more stakeholders and increase the knowledge about what is needed to tackle that issue. With the support of policy development, then we can implement cost-effective and efficient measures such as taxation, ban on advertising, or improve smoke-free places. So it will have an effect on the cancer deaths and tobacco-associated disease. In parallel, when you invest in prevention measures, you increase people's health and wealth. You relieve actually the burden on health systems. So increase actually the wealth of the national economy. So coordinated multi-sectoral approach, multi-stakeholder approach is beneficial for the smokers, the public, and the countries. And having all of that together, and my work also is to really having these tobacco control plans, laws integrated in national cancer control plans or health strategies. So there is a more weight to that. And I'm done. Thank you. Thanks a lot.
Thank you so much, Yannick. Thank you for keeping time as well. Now, because of the time that we have, we will permit questions verbally. And I would ask anyone with a burning question to either Yannick or to Acheng to go ahead and unmute yourselves. Anyone with a question? Mishka, I saw you had a question for Acheng on the chat.
I did, and I see Acheng, you've answered it there, but I was okay. So I'm trying to read and talk at the same time. I was just curious, sort of in terms of the, you had mentioned later after I posed the question that there is KETCA specifically. You have connected with the cancer organizations, but in some of that initial work where CSO actors are building that advocacy piece directly to government, how many of those people are wearing multiple hats? So apologies, I can't see what you wrote in the chat, but if you wanted to share more about that.
Well, that's fine. I think I can share on that. In the agitation for the policies to the point where up to 3 years ago, most of the civil society organizations were just wearing one hat of tobacco control. But over time, we've realized that there are cross-cutting issues, and we've seen a number of civil societies also coming up that wear both hats, some addressing cancer control and as well as tobacco control. For us, we found it more strategic to build an alliance with the Kenya Network of Cancer Organizations, because we feel that with a more coordinated effort in tobacco control and in cancer control, it's easier to achieve much of our objectives. Thank you. I don't know whether that answers.
Yes, it does. Thank you. Do we have any other questions?
I have this is more of a comment than a question per se, but thank you. Those were really excellent presentations. I was sort of wondering, because you gave, Etienne, you talked about this success story in Kenya. I wonder sort of like how things are going in some other countries that might not necessarily have this success stories, especially in some African countries that do produce tobacco, sort of, how, because I know sometimes, countries sort of play off of one another. Like, how can you sort of encourage other countries to look at what Kenya is and say, this is something we want to strive towards as well? So like, what is in it for them in a way, to sort of strive towards achieving what, you've been able to do in Kenya? So that's a big question. So it's more of a comment than something I expect you to have an answer for. Yeah.
Maybe I would word it differently for Yannick to respond to, because you're asking from a global as opposed to the in-country. Yannick, if you had a magic wand where you could easily transform what has been done in the Kenyan space to the other countries that you're serving, what is the one thing that you would encourage others to do that would bring the same kind of success to the other countries that we're working with?
Well, I don't have a magic wand actually, but I think it really depends on the national context, and Kenya is a good student, I would say, and they were the first to be part of the FCTC. The thing is the political will, and I think I think you touched on that political will. Coordination, governance, CSOs, and it's all about the multi-sectoral partnership and how to apply that. A peer-to-peer, best practice sharing, sharing knowledge, resource mobilization, all of that. What you apply to my work with National Cancer Control Plan, what you can apply to that, you can apply it to tobacco control. The only challenge I would say, it's different, but you have the tobacco industry behind it. You have a lot of money behind it, and that's the name of the game. So applying to, there's this will behind it of all the different stakeholders that makes the difference, but it depends on the context. And you're right, Dayo, about the countries where tobacco is one of the main agriculture. I'm thinking about Zambia, Tanzania, where there are difficulties to convince the government that if you stop and you just switch and swap your culture from tobacco to others, you won't lose any money. You will really win years of for your population. And really, that's one of the arguments. Investing, like in cancer control, investing in tobacco control, there is no harm to do that. But it's difficult because they can see the short-term issue with, oh, we will just cut the tobacco production and then people will starve. But that's not that. And they have to invest long-term to tobacco prevention or cessation. So that's one of the argument I would use. Name of the game, money, and having the different ministries to buy in your advocacy, and with the data and all the example, not only in Africa but in other countries where it worked. But Kenya, there are a good example, really. Thanks a lot.
Thank you. So Achieng, in 1 minute, probably you can put some remarks to that as well.
Yeah, on top, Yannick has really made a very strong point in terms of political goodwill, and different countries respond differently to the tobacco control message. But we're also finding it very important to build alliances and partnership with the regional networks like the African Tobacco Control Alliance, because it being an umbrella organization that supports tobacco control in different countries, we tend to address issues borrowing from, say, for instance, Kenya, and seeing how best it can be applied in different other jurisdictions. Thank you.
Thank you. I think we have 5 minutes to this call to ending. If anyone has a burning question, otherwise I would like to give it to Christine Mugositati, who is the Executive Director for Kenyan Network of Cancer Organizations, to take us to the announcement segment of this meeting. Do we have any burning question? I see no hands raised. Our presenters today have been amazing. You have given us very good presentations and very deep information in the 1 hour. I think this is a session that would have been done in very many hours, but you've managed to concise this into such a short time. So thank you very much. Christine, over to you so that you can take us through the announcement segment. Thank you. Christine Muga.
So I think Christine logged off. I can take you through the announcements. So thank you very much for joining us today. Yeah, thank you very much for joining us today for our session. And thank you to our presenters for the good presentations. We are going to share the recordings after this so that we can, and as well as the presentations, the slides, so that we can go through and maybe revive if we wish to. Then I would like to remind you of our session on October 7th to be on COVID-19 and cancer. And specifically, we are going to be focusing on vaccine, COVID-19 vaccine, and its integration with the cancer. So please join us as well for the session. So I don't think I'm forgetting anything else, Mishka.
Nope, nothing else for me. Thank you all very much. And thank you, Benda, for your excellent facilitation, and to Achieng and Yannick. I will just add one last piece, actually, is to just join us on Basecamp to share any resources. Yannick, you had mentioned the website and any other specific resources there, and Achieng as well. If you have anything that you can add there, I'll post in the chat the link to the Basecamp page. So we're back over to you, Benda.
Thank you so much. I see we still have some bit of comments, and so we have Joel Gitari, who has joined us from Ketka as well. He's the chair. He says it was a wonderful forum. We're happy to be part of it, not just today, but it's what's ahead, in what's ahead. Thank you, Joel. I see Yannick has made a comment about making cancer control people aware of tobacco control measures, and that's the goal of UICC, and also in training. And I think the one slide that Yannick presented that has very many resources that I would actually consider that we would have another session, we can go through those resources as well. I would urge everybody to have a look at that and see what you can customize and utilize in your local settings, because quite honestly, having 80% of the world's consumers live in our locale and being affected, regrettably, with dire outcomes, it's not something to sing home about. It's something that we all should pull our resources together. Please remember to get this conversation onto Basecamp. I see Romero, Yannick has something to say. Yannick, go ahead.
Just one thing, and one, you know that what we've heard since years is that the smoking prevalence is low in Africa, but the tobacco industry is looking at Africa actually, not only because they are producing tobacco a lot there, is that they are targeting smokers, they are targeting with their advertising, with the taxes and so on, Africa is one of the next target of the tobacco industry. And this is why we really all need to work together to prevent that. Because they are working in Europe and US and Japan, for instance, with their new products, with e-cigarettes. But at the same time, they are still producing new cigarette brands, and they are selling it in Southeast Asia, in Africa. And that's the thing. They want the replacement generation, and it will have, the place will be Africa and Southeast Asia. So just a warning. I know that we all know that, but it may be worth to say it. Thanks a lot.
Interesting. Thank you. Any other person who has a comment? We're about to close the call, but thank you so much for staying on. And I think it's a conversation that cannot be ended now. It ought to continue, that we can stop this movement coming into Africa now. We shouldn't allow it to be that we're being targeted for it. So thank you. Thank you for that, Yannick. Anyone else has a comment? I see we have a comment on the chat from Thomas Lindy. In fact, the industry is already rolling out oral nicotine pouches that appeal to the youth and can be consumed discreetly. Can you imagine that? I mean, that is just, yeah, one of those things that makes you want to pull your hair out. But before we pull hair out, we ought to galvanize our energies towards tobacco control. The same with shisha smoking. It's supposed to be funky. It's supposed to be very stylish. And yet it's one of the most lethal. So we ought to look at ways to ensure that our people understand. And community engagement coupled with policy engagement would be the way to go. Any other comments? I think this has been quite enlightening. And if we don't have any other comments, we would be closing there. Or alternatively, we can have some of the people who have not spoken at all, like Anna Cabanis, give us a word or two of wisdom on tobacco control. Anna?
Brenda, this is not fair. It's not my expertise, tobacco control, but I just, I could not be more, well, I'm totally appalled, and I couldn't agree more on everything you said in this session. I really don't know enough to actually weigh in, but I do believe that everything you said I didn't know that Kenya had done so much work on this. So it is really interesting to see that, a country just has taken over one issue. And so really, really grateful for the talks and everything.
Thank you, Anna, and thank you for accepting gracefully my putting you on the spot. How about we put Joel Gitari? And we're at the top of the hour now. Yes.
Thank you. I'm also happy to be part of this. I've just been giving another talk on the same tobacco control. And as you have rightly said, it's a really sad story that Africa is being targeted. And this fellow said their future is in Africa, and especially in the emerging products. So even as we talk about tobacco, the traditional way we know it, we should also know that these people are coming up with new ways of ensuring that we remain in captivity to tobacco and nicotine. So please, let's all of us arise and say no, because it is for us, it is for our children. If we do not do that, then the future of Africa is actually black, but we are equal to the task. Thank you so much for the forum. I look forward to more engagement as we continue. Thank you so much.
Thank you so much. The last person to address us today will be Thomas Lindy. Thomas.
Oh, Brenda. Thank you. I've just been listening in, and it's so encouraging, the wisdom that we are sharing here. And Acheng's presentation was so much enlightening, and I liked the way he brings out the linkages. It's upon us to actually work with our policymakers and see that we can be able to save our generation from the the cancer epidemic that is really being fueled by tobacco use. And as I've just mentioned, the tobacco industry is actually rolling out these products. Here in Kenya, they are building a multi-billion factory to produce the nicotine pouches. And that means disease, sickness, and death to our people. And that's so bad, so bad. Yeah, thank you very much, and asante sana.
Thank you so very much. All of you, thank you so very much for your time and thank you for your contribution. I think it has been a very well spent afternoon, evening, morning for all of us. It shall be shared and we shall continue to engage on other forums as we go along and speak tobacco control, cancer control, and ensuring that we safeguard the health of our people. Thank you all for your time. Thank you.
Thank you,
Thanks, bye,
Brenda. Thank
everybody.
you all.
Thank you.
Thank
Bye
you.
now.
Bye.
Bye.